Here's what today's program will look like. Each panelist will give a brief introduction about themselves. It doesn't have to be that brief. You can just say, tell us about your NF story. Then I will ask each of them a question to start us off. We'll open it up to your questions after that, so just leave them in the Q&A box in the bottom of your screen. If you'd like a specific person on the panel to answer your question, please let us know. We do want this to be interactive, so don't be shy. And on another note, I just want to add that I am also a parent of a daughter with NF1, and you'll be hearing more from the panelists here, but I may jump in from time to time. Thanks so much for joining us, and let's start with Linda. Linda, tell us your NF story. Can you hear us, Linda? All right, we're having some technical difficulties. So
Hi, I'm Linda, and I live in Massachusetts. And yeah, you can't hear me?
Yes, we can hear you.
Hi, can you hear me?
Yes, good.
On the phone while I'm doing this. So I live in Massachusetts. My daughter.
Oh, I think that may not work. We may come back to Linda. She told us she's in New Hampshire today, and there's been a power outage there, so I think she's having some trouble. Linda, we will get back to you, so just signal to us when you're available. Kaymee, why don't you tell us about your NF story?
Okay, so I'm Kaymee. As Sharon said, one of my sons, Tate, has NF1, and he is 8 years old. Our NF story probably sounds somewhat familiar to some of you out there, as he did not inherit NF, and we had never heard of it before he was diagnosed. When he was a baby, his development was, I guess, kind of on the late side of normal, so he wasn't severely behind on anything, but he would kind of start doing things toward the end of that normal window. But we didn't really have any concerns until it was kind of, that time for him to start talking a little bit more. Tate had no problem with just single words, but he really struggled with putting phrases or sentences together. So we started speech therapy. He also did some physical and occupational therapies to help with motor skills, but speech was the big one. And in working with his primary care doctor, we were referred to several different specialists before actually hearing the word neurofibromatosis. The first time we heard it was when we were referred to dermatology, and that's where we learned about cafe au lait spots. We left that appointment with more referrals, some pamphlets about NF, and the words of the doctor saying, "Please don't Google it," ringing in our ears. But I did Google it, and that's how we very fortunately found NF Central Plains. So our friends at NF Central Plains have really become our NF family. Both my kids love going to the various events throughout the year, even though COVID really kind of screwed this year up for us, but it's still a lot of fun. And it's great to see NF patients of all ages able to connect with each other and find new resources. And it's also really great for me as a parent to meet other parents that can all relate. Today, happy to report that Tate is a very happy and healthy kid. He does have one plexiform neurofibroma, but right now it's not caused him any problems, so we just kind of keep an eye on it. But he's not doing any therapies right now because of the progress that he made. But there are some things that are still hard for him. Some aspects of speech are still tough. Reading is tough because of, how that ties in with speech. And some physical activities he's not as confident in some of those areas because he also has low muscle tone. But really, he's learned a lot from the past therapies that he's been in and just, being in school. And he works really hard to overcome all of his challenges.
Great. Thank you so much for sharing that. Linda, are you on? Can we try again? Okay, maybe not. All right, Linda, we're gonna just signal again when you're ready to get on.
Hacking until I get kicked out again.
Okay.
Can you hear me?
Again? Okay.
Can you hear me?
Yes. No. All right, she's going to keep trying. And we will, Linda, will you signal to me when you're going to try again? All right, let's move to Dr. Fitzgerald, and hopefully we'll be able to connect with Linda soon.
Hi there, thank you, Sharon. I'm Keely Fitzgerald, and I, as Sharon mentioned, am the medical director of our neurofibromatosis clinic at Children's Mercy Hospital in Kansas City. I've been in this position since July of 2019, originally from Des Moines, Iowa, and I did medical school in Iowa and then down to Houston for residency. And while I was in residency, I spent some time at the MD Anderson Neurofibromatosis Clinic, and that's where I really developed an interest in neurocutaneous disorders and particularly neurofibromatosis. So I've been at Children's Mercy here for 3 years, and I'm very happy to be heading up the NF clinic. We currently are a once a month clinic. We meet on the 4th Thursday of the month, but we are going to be switching over to the 2nd Thursday of the month starting in January. And our clinic usually starts with a pre-morning conference where we review images with our radiologists, and our team gets together to discuss the patients that we'll be seeing for the day and kind of come up with some thoughts and plans. Routine members of our clinic include our genetics counselors, psychology, and neuro-oncology. And then we do coordinate appointments with dermatology and ophthalmology and other subspecialists as needed. And then one of the most invaluable parts of our clinic has actually been to have members of the NF network come join our clinic, and Sharon and Jill have both been in attendance at our clinic over the course of the last year. And that is just a amazing experience for our patients and families to have that as a tool and a resource in our clinic. And they are able to really discuss and talk about what it's really like living with a child with neurofibromatosis. And our families have reported that's been very, very helpful. And so we can't wait until Sharon and Jill can join us again in clinic. We are continually trying to expand our clinic and add additional resources that we think will be helpful. So we're always open for suggestions and constructive thoughts and criticisms. In addition to the monthly NF clinic that we have, I also see patients in my own clinic with neurofibromatosis as well, and other neurocutaneous disorders. And I'm very happy to be here today, so I will welcome any questions or thoughts anybody has.
Great, thank you. We're happy to have a doctor's perspective and parents too. And I will step in for Linda until she gives me the okay that.
Sharon.
Are you there?
I'm unmuted. Yes, I'm here. I'm on the phone.
Great, sounds much better. Go ahead.
Okay. So I live in Massachusetts, and I was living in California when my daughter was born. She was diagnosed, well, they kind of found some capiole spots when she was 6 months old. We had never heard of it, so it was a spontaneous mutation. And as everyone probably has gone through, you find out and you look it up and you get really scared. And then we moved to Massachusetts. When she was 4, she was definitively diagnosed when she had axillary freckling as well as capiole. And then just had pretty mild, different things depending on your perception of what's mild and what's not. But I've learned a lot. I worked at NF Northeast, and so did advocacy. And Melissa's now 23. She graduated through college with some little bumps along the way. But I'm happy to add our experiences to this conversation.
Great, great. Well, thank you. I'm sorry we can't see you at the moment, but we're happy to get your input. Linda, you mentioned that Melissa recently graduated college, which is a great achievement. And I'm wondering if you can talk about any academic challenges she had and how you handled those.
Yes, she did have some. When she was younger, she was on an IEP. She had low muscle tone. So when she was really little, she was in early intervention. It started at age, I think, like 18 months because she wasn't walking at 1. And then she started walking at 2. And she got PT, OT, and speech therapy through early intervention. And then went to an integrated preschool. So she got support services there. And then when she was in the public school system, she was on an IEP. And she, for the most part, got speech, PT, and OT, and then kind of grew out of, I guess you could say, the PT and OT and speech, and then just got some support services in terms of, extra help. She had to sit in the front of the class, things like that. And she was diagnosed with ADHD. We participated in the lovastatin clinical trial. And when she was younger, in like middle school, I guess, but she was taking ADD medication, which did help a lot. And she was able to, graduate with kind of minimal services at that point. And in college, went to, maybe have a tutor every now and then, which I guess a lot of students did, and graduated. So, I think I will say during these times, when especially she was younger, it was really hard for her to be pulled out of class. And that's what they did a lot, for some of the kids. You go to speech, you get pulled out of class. And I know that they're trying to do it more as part of the general classroom, so the therapist would come into the class, so you don't have that kind of stigma of being the special kid that gets pulled out when you need extra help. That was really, I would say, really tough for her when she was young, which I can't blame her. Be like every, so it's hard. As she got older, she got more.
We're losing you in
herself.
and out, Linda.
Can you hear me now?
Yes. You said
Okay.
when she got older?
She advocated for herself more, and kind of said, I don't need this help. And so that was really good to see her kind of mature in that way. Great.
Can you just tell everybody, in case you don't know, what an IEP is?
Individual Education Plan. And it's in Massachusetts, and I think it's in several other states. It's probably maybe called something different in other states. But it's something that I just went to a public school, so the state provides for therapists, for kids that, if you test, you're tested, say, for physical therapy and things like that. If you can't meet standards, then they'll give you a therapist in school. Great.
Kaymee, you were nodding your head. Have you had any experience with Tate's academic challenges? Can you tell yet? He's a lot younger, but.
Yeah, no, it's actually, our stories are very similar, just with the way that they kind of came up, through the different therapies. We started with early intervention as well. He kind of, once they reached, I think it was 3 for us in Kansas, that's when they started taking the therapies actually through the school and just kind of moving on as he went through. So we also did speech and, like I said, physical and occupational therapy. He received some academic services as well. Currently, he is not on an IEP, which I know is every parent out there that has a child on an IEP is like, oh my gosh, you let him off the IEP. But it was one of those things that, the district, our school district, again, here in Kansas, let us know that he was meeting all of the standards for someone his age. And they didn't want him to have that stigma, kind of like Linda was saying about, being different. So we are seeing how it goes with, you know, him really just trying things on his own. And it's tough. It is tough. I will say that, especially because we are currently virtual learning due to COVID. So it's different for me learning how to do third grade multiplication. But it's, he's trying very hard, and I think he's starting to get to that point where he's figuring out that, you know, there's some work that I have to put into this. And so it's been good for him.
Very good. I want to ask Dr. Fitzgerald a question, a follow-up on that too, but I just want to throw in that Alana, my daughter, was in the same position. We did not have her on an IEP. She was kind of same thing, kind of on the border and needed help and didn't need help and kind of on the border, so we didn't. But I will tell you that as she got older and it was time to sit for exams in high school and sit for the college entrance exams, and she needed more time or she needed quiet space, they would not do any accommodations because she had not been on an IEP. So it's just kind of an interesting thing I hadn't thought about when she was little, that later on she might need some extra accommodations. So just something to think about. It's very case specific. But Dr. Fitzgerald, is there some educational testing offered at the clinic or some kind of assessment?
Yeah, so we have 2 neuropsychologists who are involved in our clinic, and those neuropsychologists can do a full gamut of testing, and ranging from IQ testing to memory, attention issues. They can look at different types of processing and those sorts of things. And I generally think it's helpful for anybody with neurofibromatosis to have that type of testing to kind of establish a baseline and to really understand areas that kids are stronger in and areas that kids might need a little bit of help in. It's not always obvious where a kid is struggling, and so that type of testing can really help pinpoint those areas and provide resources to the school. They can really lay out what would be most helpful for kids with certain deficits. So that testing, I think, can be especially helpful to take to the school to make sure we have all of the resources in place to help kids excel and maximize their potential.
Great, thank you.
Sharon, can I just add something to that?
Yes, please.
Sharon?
Yes, please do.
Okay, I just wanted to say, just to agree with that, and also add that Melissa got, and I think it's important a lot of times to get a neuropsych eval. Melissa had one she went to Children's Boston, the NF clinic there, and that helps a lot because sometimes school districts, because they're so short of cash a lot of times, it's hard. They really need to justify that your child should be on an IEP. And some school districts are different than others, and some make it a lot harder. And Melissa was in a pretty decent school district in terms of that. But it's good to have kind of an independent evaluation, just so that you can kind of go back if they're maybe fighting you on keeping certain provisions in the IEP that you want to keep, that if you have another outside evaluation of her, that you can kind of use that as to kind of fight for more services or to keep the services that you have.
Great, good point. Thank you for that. I want to ask Kaymee and Linda, since they both have other children, how you handle the dynamics with that. Is it hard to explain to the other, I guess it depends on what stage you're in, to explain to the other child why you're spending so much time going to doctor's visits with your other sibling, or how to explain NF? I guess it's a 2-part question. For Kaymee, one part is, how have you explained NF to Tate at age 8? Let's start with that question. And then Linda, you can say through the stages how you have explained to Melissa about her NF. And then we'll go to the sibling question.
So we haven't had any kind of sit down conversation, hey Tate, you have NF. It just hasn't happened. What he knows at this point is that he sees different doctors for different things. And it's very, I think it's made him very resilient. You know, when I was his age, and to a certain extent now, I'm very uncomfortable around doctors. But he is very comfortable around them just because he's been seeing so many of them for his entire life. So that's, you know, in some ways a credit to his bravery. But at this point, what he knows, he has nothing but good associations with NF, because he knows the fun stuff. He knows, hey, we get to go to the petting zoo or the pumpkin patch, or we get to go to the walk, and it's so much fun. And that's the same thing, actually, to talk about the siblings, same thing with my younger son who does not have NF. Just today, he was like, why didn't we get to go to that walk? I really miss getting to go and get my face painted or whatever the case may be. So right now, there's nothing but good associations with that. And personally, I think I want to keep it that way for as long as possible. I think I'm probably starting to kind of realize that, hey, things are harder for me than they are for other kids. And, you know, I struggle with, you know, kind of talking about that kind of stuff with him, but I think we're just kind of gonna play it by ear and see how it goes.
I think what I hear you saying, and I think what most of us would say, is you just treat it in an age appropriate way.
Yeah.
When they start asking questions, you just answer it. And as they get older and they ask more, you deal with it then in a different way. So.
Yeah, he has started asking about cafe au lait spots. You know, what is this, or what is this patch right here, I think is what he calls it. And then my answer is, it's just part of your skin. It's just part of who you are.
Great. Thank you. Linda?
So in the beginning, I didn't say anything to Melissa because she was little, and you know, she was around 4. She had to have an MRI because her left eye eyesight wasn't as good as the right eye. It was a lazy eye, and they wanted to make sure it wasn't caused by an optic glioma. So she had to have an MRI, and you know, we just kind of told her they wanted to, you know, make sure everything's fine with your eye. And then as we went, like around that same age, we also were going to the NF clinic, and the neurologist had some, I remember he had some medical students in, and he asked them, asked if we could let them in at our appointment, but they didn't have the greatest bedside manner, and they were, asking me, does she have tumors and all this kind of things in front of Melissa, which was just really hard for me because she didn't understand. And so as she got older, she was asking more questions about it. And I think what I had kind of read and learned was to just answer their questions as they ask them and try to be as honest as you can, but don't say more, don't go into it more than what the question really needs. And I know that one thing that I thought was really helpful for her was the NF Buddies book. And I think, Sharon, you probably can get that at NF
Yes.
Central Plains, but also the NF Network for those of you in different areas. And Melissa really liked that because it's a cute little book. It's written for, I would say, you could get it and read it to your child before they, if they can't read yet, but maybe, 6 or 7. And it's kind of has pictures of other kids that have NF, and it just kind of treats it in a helpful way for younger children. And once, as she was getting older, she would go look it up on the internet, which, as you probably all know, isn't the greatest place. So I just kind of learned not to hide things from her, but to be optimistic and not go into a long answer to the question that she asked, and that seemed to work.
Thank you. That's a very good point. And if anyone would like a copy of that NF Buddy book, if you will just send an email to NF Central Plains, we'll be happy to send you one because it is a great resource. So thank you for that. We're getting a lot of questions, so I think I'm going to try to, you all, if you want to look at them yourselves, but I'm happy to kind of summarize them for you. We have one that is talking about, Amy asks about her niece who's 12 and she's going through puberty. So she's having extreme mood fluctuations and they seem extreme. And she's asking if that could be related to NF and also if there's any suggestions on how to help her and maybe calm her down. Dr. Fitzgerald, would you like to start? And then I'm thinking that Linda might have some insights about young women who are very emotional.
Yeah, sure. This is certainly something that can be associated with NF1. Kids with NF can experience many different types of behavioral difficulties and issues, things like inattention, hyperactivity, impulsivity, but also social challenges. They may have issues with communication type of things. And then we do know that children with NF may also have higher levels of anxiety, depression type of symptoms as well. So I'm not surprised to hear that that she might be having some challenges, especially going through puberty, as you mentioned. That is a challenging time already, but with NF1, it can be even more challenging. In terms of things that you can help, manage those types of behaviors, really consistency is important, routines are important, reinforcing positive behaviors, of course, and also giving kids expectations can be really helpful in terms of, making sure that kids know what is expected from them and how they're expected to react to things. I will let Linda weigh in as well, as she probably has a much better frame of reference for this type.
Thank you.
Well, I think Dr. Fitzgerald, you hit all the nails on the head. There's a lot of things going on at that time, and I really don't know how much is attributable to NF and how much is just the general life at that age for someone who's in middle school. And then dealing if they have other things, issues caused by NF, whether it's ADD, anxiety, social issues, which can all be related to NF, NF type 1 anyway. So that it's a really difficult period anyway. I think I know for me, I read a lot of books about learning disabilities and things, and I think consistency and trying to stay calm as a parent is key, because sometimes when your child is really moody and they're yelling and it gets you upset. So I think going in another room if you need to, or just kind of set the expectation ahead of time, I think is helpful. If you say to yourself, okay, if she, the next time this happens, how am I going to handle it? And I think if you kind of expect it to happen, you can plan ahead as to what your response is going to be, rather than waiting until she flies off the handle and then you kind of yourself get kind of flustered. So I think understanding all about the reasons why she might be upset and just trying to prepare for that and stay calm and listen. I think you don't have to solve all their problems, but just listen when they're upset, and maybe that's all they need.
That's great. There's a good message there on self-care for the parents so they can stay calm. So I think that's a very good point. And Linda, while we have you on, can you talk briefly about how you deal with a sibling issue when you have a child with NF and how that changes your family dynamics?
Sure. I think it's depending on how many issues your child with NF has and maybe their birth order. So Melissa's the oldest and her younger brother is 2 years younger. And Melissa is an introvert, doesn't make friends easily, and she had low muscle tone, so she wasn't the best athlete, and she had ADHD, so she had a little hard time focusing in school. Meanwhile, her younger brother, which kind of makes it even worse, is outgoing, has tons of friends, really good in music, really athletic, great in sports, does really well in school. And every time he'd have a play date and she wouldn't, it would just crush her. And so it got to the point where I know with grades, she was really feeling badly, and Justin always did really well. And it got to be kind of sad when I think about it, because he would be really excited, when he was little, about getting good grades, and we'd be at dinner and he'd say, "Oh, I got an A on my math test," or something. And I would instinctively look at him with like, don't say anything, because I didn't want Melissa to get upset. And that's not great either. So when he was old enough, he knew she had NF. He thought it wasn't a big deal. He thought it was kind of cool because we got to go to some fun walks and things. But I kind of had to explain to him that, she was harder, things were harder for her. And I was really proud of him, but try not to, we would talk about his grades, maybe not in front of her. And at the time I felt really bad doing that. It's almost like you're trying to pick like which kid you're going to support and which you're not. But it really, I believe, and he told me too, it made him be much more empathetic person, especially in school. If he saw someone that didn't have friends, or if he saw someone that was alone, it really bothered him. And he didn't like it when other kids made fun of other kids. So I kind of think it made him a better person. I think if Melissa was in and out of the hospital a lot, that's going to be even more, cause more problems with the sibling, because obviously when one's in the hospital, they would get a lot more attention. So in that respect, I think maybe even getting a therapist involved to help with the family dynamic when one of the kids is really sick might be the way to go.
Okay, great. On that note, just to follow up, we do have a question from someone who lives in rural Hawaii, asking about therapists, speaking about therapy, whether there are therapists that are, maybe she was interested in having a therapist that knew something about NF. And what I would recommend is, it depends on what your issue is. If your child is having issues on learning, you may be looking for a specialist, more an educational psychologist, versus if your child is having some social struggles, you may look for a therapist who specializes in autism or being on the spectrum, versus family issues. Then you might look for a therapist who deals more with a family practice. So I think it's hard to answer that. I think it depends on the issue that you're having. Another question that comes up quite a bit, and Dr. Fitzgerald, if you could address it, and then I'd like to hear from Kaymee and Linda how you handled it, is about imaging and how frequent imaging should be for your child with NF.
Yeah, this is something that we always think about and are always talking about. So we don't currently have any specific guidelines on when we should image, how early do we start imaging with MRI scans, and how frequently we should do so. So this is a very case-by-case determination and a very patient-by-patient decision. As you all know, imaging young children requires sedation with anesthesia. And so when I'm considering imaging, I really want to make sure, it's appropriate. We have a specific, something specific that we're looking for and that we're ruling out. And so I always like to have a very open discussion with parents. And I want parents to be comfortable and on board with the decision to get imaging. The most common tumor type that we're looking for in the pediatric population would be the optic pathway glioma. And so typically we can detect that in kids who are less than 7 or 8 years old. So really one of the most important things would be the eye exam. And Linda mentioned that her daughter daughter got some imaging after eye exam, showed some difference between the two eyes in terms of vision. And so we really do use those other cues to help guide when we should really image. If we have any red flag type of symptoms that come up, we would always, of course, consider imaging as well. And if we do start imaging and we find something that we need to monitor, we kind of determine how frequently we're going to follow something. And sometimes that's every 3 months or 6 months, or we follow things yearly. So it's always a very open discussion, and I'm always willing to hear what parents think and what parents are concerned about, and we decide when we should image together.
Great, thank you. Kaymee, any thoughts on imaging?
I really love how Dr. Fitzgerald was saying that it's, that's a conversation with the families, because that's really how it should be. When we were kind of in the early stages, getting referral after referral and seeing all these different doctors, it was kind of information overload for us as parents. And I think it was the way that we took it all in was that, okay, he needs to have all this imaging done. We need to see if there's anything wrong. We need to see where things are at. And it was, fortunately, he was kind of young enough that I don't think he really recalls much of that whole thing. But you're right, he had to be sedated, and that was, kind of a traumatic thing for him, which, again, I'm glad that he doesn't really recall any of it. But as things have kind of gone on and you see how they develop and, how they're growing and everything like that, you kind of start to realize that, okay, maybe we don't need to do this so frequently. Maybe it can, we just kind of wait and see if there's suddenly something bothering him, if he's suddenly starting to get all these headaches, or, his spine is starting to curve or something along those lines. Okay, then we can talk about imaging, but I don't want to put him through any more tests and everything than what he really needs to go through at that time. So if there's, nothing that seems to be bothering him, let's not push it.
Great point. Again, it's that same idea of partnering with your doctor and having the conversation. Great. Linda, anything on imaging you want to add?
I agree with Dr. Fitzgerald and Kaymee. In the beginning, I thought, I want her to have an MRI every year so they catch any change, right, they nip it in the bud. But that's not really a great idea. Lots of times, that you might see something that really doesn't need to be addressed, and so you worry for no reason. So I agree that you really should wait for a symptom, for a reason to check. I mean, it's probably good to have a baseline MRI, so then a couple of years later or whenever, if something else comes up, they can have a baseline to compare like another MRI to. But I think that the general feeling is among specialists is really you should wait till you have a reason to get an MRI.
Okay, great. We're all in agreement. That's great. We have a question that has come up about pain and pain management, and about whether it's better to deal with pain surgically, medications, or alternative therapies. And I would imagine that's very case specific as well. But I'm wondering if Dr. Fitzgerald, if you'll start, and then I don't know if Kaymee or Linda have dealt with any pain issues with their children and want to comment on that as well. You're muted, Dr. Fitzgerald.
Sorry, thank you. Yeah, pain can be an exceptionally common and challenging issue to tackle, and I really think the best approach to pain management is a very multidisciplinary, multimodal type of treatment. So a combination of medications, psychological evaluation, biofeedback, all of those things can be very helpful. And at Children's Mercy here, we do have a specialized pain clinic that really does take that multidisciplinary approach and considers all of those different angles. And I think that our outcomes are better when we do attack it from multiple different areas. Unfortunately, all of our medications have side effects. So, getting into some of the other, some cognitive behavioral therapies and some other types of biofeedback and things kids can get significant benefit from those things, and we don't have to worry about the systemic side effects that we see with some of our pain medications. So I really do like to advocate for the multidisciplinary approach. We do also have some data for some alternative therapies, and we do a fair amount of acupuncture and things like that here at Children's Mercy as well. So this is an area of a very hot topic area, treating pain and doing it, as efficiently as we can and limiting side effects. So I think there will be more and more treatment modalities that we find are beneficial. So that would be my thoughts on that.
Thank you. Kaymee, have you had to deal with that with Tate? Any pain issues?
We really haven't that we know of. After hearing Dr. Bono's session earlier, though, it kind of makes me wonder about tolerance and, if there aren't just some things that maybe he thinks are normal, that, he's not going to complain about a headache because I always feel that way, kind of thing. So that's like mom paranoia now that I'm getting into. But no, we really haven't had any of that come up yet, thankfully.
Okay, good. Linda?
No, not on a chronic level. But it was funny what Kimmy was saying about the headaches, because that's always a worry for a parent of a child with NF, because you immediately think brain tumor. And, Melissa would have headaches, and usually I'm just like, oh, you're fine. And then, if it lasts a week, when she was in college, I got worried. And, fortunately we called her, she was still at Children's Boston then, and the neurologist, just said, well, have her take, ibuprofen, and then it eventually went away. And we think it was because she had new glasses and they were too tight. So once she got those fixed, her headache went away. But it just goes to show it's just hard not to worry.
Yeah. And speaking of that, that's a good segue to my next question. As parents, we seem to constantly be worrying about our children anyway. And then with NF, you just have this radar that goes up every time they complain about something. I'm wondering if Kaymee and Linda would like to comment a little bit on advocating for their child, either in terms of with doctors in a medical setting or in schools, or just kind of channeling that energy we have as parents into advocating for our children. Kaymee, are you
go first?
Go ahead, Linda.
Oh, okay. I have learned how to be an advocate through this whole thing. I thought of doctors as, I didn't always have I didn't have a relationship really with doctors. You just went to them and you didn't really question anything. And then I think it's just being a parent, you definitely advocate for your child just without even thinking. And the more I got to know the doctors, and they were just all so helpful. Been very fortunate in that respect, but I think most physicians are like that anyway. And then dealing with them when I worked for NF Northeast, I dealt with a lot of doctors, and I just got to realize how important working with your doctor is gonna be in terms of and letting them know that whatever's going on, and just keeping them informed, but definitely trust your own instinct in terms of if you think something isn't right with your child, even if maybe you take them to the pediatrician and they don't think there's anything wrong, there may not be, but if something in your gut tells you that there is, there's no harm in checking it out. And maybe finding out that it isn't what you thought, which is good, but don't be quiet. Don't just worry. Oh, maybe I shouldn't say anything, but I think the physician would rather hear from you than have you not bring something up that might turn out to be something important, and maybe not, but at least they can rule it out. I know that Melissa's neurologist several times, maybe saw something because she had curvature of the spine and thought maybe something was off, and Melissa was going to a orthopedic surgeon to get that checked, and it turned out to be fine. So, at the time I was worried about that, but then it worked out. And I would much rather be in that situation than not having anyone brought that up and then had it turned out that there was a problem and, you didn't look at it soon enough. But I think as you get used to dealing with doctors, you'll find that you kind of naturally are a good advocate for your child.
Great, thank you. Kaymee, any thoughts?
I agree with everything Linda said about, with physicians and everything like that. We've been very fortunate that we've had, very good relationships with all of our doctors over the years. And we're also very fortunate that, that it was diagnosed early and that we're able to have the resources that we have. But as far as school goes, and that we were talking about IEPs earlier, and that's another area that you really need to advocate for your child as well. And that's been probably for me a little bit more frustrating, just because it's even less common that a teacher has heard about NF, as opposed to a there's doctors that don't know how to treat it properly, and there's even fewer teachers that know what that means. The school that Tate's at now, one of the other teachers in another grade level, her son actually has NF, and so there was a little bit more awareness there that was helpful. But it is difficult. Every school year, I will go to our website and I will print off the little fact sheet that is helpful for teachers, talking about common things that you might see in a child that has NF, things that might affect them in a classroom, and I send that to them and I give them a little synopsis of, hey, I'm not trying to be that parent, but at the same time, I'm trying to be that parent, and I want to let you know that my kid might need a little bit of help, and I want to communicate with you on what I can do to help my child be a better student, and on how we can work together to make it a great school year for them.
Great, thank you. We're going to be wrapping it up in just a minute. I want to make sure that Kaymee and Linda talk a little bit about the NF network, or their involvement in NF Central Plains. I know Dr. Fitzgerald mentioned that we do help at the clinic, and at least give parents just a parent's perspective, tell them that we're here to support them. And I just would like to know, before we ask each of you for one piece of advice to end it with, ask Linda and Kaymee to share their views on how it has affected your journey to be involved in some kind of an organization that supports NF families. Kaymee or Linda, doesn't matter.
I can go first. So it's a great help. When I moved to Massachusetts, when Melissa was 4, when she was definitively diagnosed with NF, my sister saw an advertisement in the local paper for a miniature golf tournament, and it was to raise money for NF Northeast. And so they, had their phone number in it. So I called them, and the executive director there, Karen Peluso, hooked me up with another mom who had a son Melissa's age, and that was really important to talk to other parents, just because unless you have NF yourself, in Melissa's case, we never heard of it. It's really hard to figure it out on your own. And so talking to other parents, getting trusted information from an NF organization near you or the NF network makes a huge difference. I remember the first newsletter that I got had all this information about NF research, which I hadn't known about, and that was so made me so hopeful, because there were so many things going on that were going to help my daughter as she got older. And you can't imagine years ago what it was like compared to now. And then things are just happening so fast with the research that it really is helpful to understand that things are getting better. And having a resource, having people to talk to that are going through what you're going through or went through what you're going through is huge.
Thank you for that, Linda. And I have to say, you've given a lot back to the community too. So thank you for that too. All right, Kaymee.
I agree with everything that Linda said. We were in the process of, meeting with doctor after doctor, and is again in that Googling spree that I kind of went on that we stumbled across NF Network. And I think it was maybe a month away from when the walk was going to be for that year. And so we were very blessed with our family being so supportive that we just kind of gathered everybody up, and we had, aunts and uncles and cousins attend the walk for us, and we raised a whole bunch of money, and it was really exciting. And, we show up there, it was our first time there, and just meeting everybody and just feeling very welcome. Again, that's why we call them our NF family, just because they really are just an extension of the rest of our family, because we talk all the time, and we plan different things all the time, and it's just a really fun and safe, I guess, environment to be a part of. Just being able to talk with people that are going through what you're going through is really nice. It's really refreshing, because you just don't get that in your everyday life usually.
And if you all go to the walk, you'll see a huge team. It's probably Kaymee's. It's grown over the years. It's wonderful, great support. So we have one more question, and then and this one I'm going to address. It's a little bit tricky. This person asks how you talk to a 15-year-old daughter about sex and the 50-50 chance of passing NF on to your children without totally terrifying her. And I would recommend that you go on the NF Network website and listen to the most recent webinar. It's a parent panel where we have a woman give her view. I will tell you, it's one view. There are lots of views on this about having children with NF, but she gives an interesting perspective, and I think that would be a good resource. I wish we had more time to talk about it. I think it's a very personal decision, and so it's hard to, we could have a whole hour or 2 hour discussion on that alone, unless Dr. Fitzgerald or Kaymee or Linda want to pipe in about that.
I could just add something. Just recently, my daughter switched over from the NF clinic at Boston Children to the NF clinic at Mass General. And her neurologist there, who is new to us, is a woman, and she talked directly to Melissa about childbirth or having children. And Melissa knew, because she's read, and I've talked to her when she was younger about a 50-50 chance of passing it on. And at the time when she was younger, I just kind of said, well, there's lots of options you would have that would help you, decide whether you want to, take the chance that you'd pass it on, or other options that like in vitro and things like that. So she didn't really talk much about it then, but her doctor at Mass General went over the whole thing, and there are a lot of options. So I would recommend to the mom or the parent that's asking this to educate yourself on what the options are, and then maybe try to generalize. You don't want to, I think at 15, you don't need to give all of the information, but there are options. So I think that's very hopeful. And especially if she's only 15, by the time she's, thinking about having a family, there could be a whole bunch, many more options to choose from.
Good point. I know they're in the works, so that's hopeful. Okay, great. Well, we are going to wrap up soon. I would like each of our esteemed panelists to give one or two sentences of advice for our parents who are here with us today. And I think I'll start just to kick it off. And it was some advice that one of Alana's NF specialists gave to her and to me. And it was, you are not an NF person. You are simply a person who has NF. And so don't let your NF define you. You can be whoever you want to be. Anyone want to volunteer to go next? Linda, you're lighting up.
Okay. I would say two things. One, I kind of just said, and that was about finding someone, talking to other parents, definitely getting in touch with like an NF organization. Sharon and I, our daughters are the same age, and we met. We were both on the board for NF Network, and we just have so many things in common. And so that's been really helpful to me. I also wanted to say I'm a worrier, and out of all the illnesses, this is one that I think is the hardest for someone that worries, because there's nothing that they can tell you that says whether your child is going to be affected mildly or severely. And that doesn't, like, they could be 40 and all of a sudden have things go wrong. So that's kind of like the worst thing you want to hear. You want to know ahead of time, is it going to be bad or is it going to be okay? So I would just say, and I know this sounds kind of strange, but don't worry. Just take things one at a time. So many times I know something with Melissa, thought she had a plexiform or thought she had something else. And I was so worried, and then it turned out not to be anything. That's not to say that things don't happen that aren't good, but if you worry about everything that could happen, you're just gonna kind of ruin your life. I know this one point when I was really worrying about thinking she had a plexiform and it was growing and everything, and then I found out she didn't. I just thought of all those weeks. I was a mess. I couldn't sleep. And so I've really tried to just kind of change my mindset is, we'll deal with it. You can talk, you can surely find another parent that's gone through it. And it's just, don't worry so much.
Great advice. Hard to do, but great advice.
It is hard to
take to heart. I am going to take to heart. All right, Kaymee.
I think mine would be, remember to let your kid be a kid. Seeing your child go through all the appointments, the tests, the treatments, the surgeries, it's certainly hard for a parent, and obviously even more difficult for the kids actually going through it, especially because they may not never fully understand what's going on. But again, they're so resilient and brave and strong. They may only be 6, 7, 8 years old with all of this experience with interacting with doctors that, in a way, it kind of matures them. So as parents, it's important for us to keep learning, keep advocating, keep being their biggest cheerleader. But it's also important for us to let our kids just be kids so that they can play and follow their passions and, be individuals. And I really like Sharon was saying, they're just a person who happens to have NF.
Thank you. All right, Dr. Fitzgerald.
Yeah, I noticed a few people were asking about how do you get into our clinic? And I just wanted to briefly address that. So we are a referral clinic. So if you get a referral from your pediatrician or your family practice doctor, you can actually go on childrensmercy.org and there is an online referral that your doctor can fill out. So I'm happy to see anybody and we can get you plugged in with that neuropsych testing as well. And I think, my advice for you has kind of already been addressed. Advocate for your kids. This should be a partnership and a team effort. And you as parents know your kids the best. And if you think something's wrong, tell me and we will figure it out. And like I think Linda mentioned, even if it turns out to be nothing, if it's something you're worried about, let's get to the bottom of it. So I hope you all can advocate for your kids. And I know that's really challenging, but I think that is such a great skill.
Good to hear. Well, I just want to tell everybody who's on right now that if you have further questions, I know some of the questions, like Dr. Fitzgerald said, were directed to her specifically about the clinic. If you have specific questions, I'm sure you can reach out to her through the clinic. You can, if you have specific questions that were not answered, to Linda or to Kaymee, you can write us at NF Central Plains. You can direct some of your questions, general questions, to the NF Network. We're doing our best. That's what we do, is a lot of patient outreach. And we hope to answer all of your questions as quickly as we can. Thank you so much for joining in today. We hope it's been helpful to you and that you enjoy the rest of your weekend. Bye-bye.